Hi guys, my name is Dr. Lee Sung. Welcome to my YouTube channel. What if I told you that one of the most famous pills in the world is also one of the most misunderstood? Millions of men have heard about Viagra. Some believe it is a miracle drug that can transform a man's performance overnight. Others believe it is dangerous and can damage the body. You may have even heard rumors that it weakens the kidneys, harms the heart, or causes long-term problems. But here is the real question. What does science actually say? Is Viagra truly safe? Does it really improve performance? And what happens inside the body when a man takes it? In this video, we are going to uncover the real scientific truth about Viagra, how it works, what benefits it provides, how it should be used, and the potential risks that every man should understand. By the end, you will know the facts that most people never hear. Around the world, millions of men struggle with a medical condition known as erectile dysfunction. This condition occurs when a man cannot achieve or maintain an erection strong enough for sexual activity. For many men, this problem can affect confidence, relationships, and emotional well-being. To help treat this condition, scientists developed a medication whose active ingredient is sildenafil. This compound became widely known under the brand name Viagra. Interestingly, Viagra was not originally designed to treat erectile dysfunction. Scientists were studying the drug for heart-related chest pain, but during clinical trials, researchers discovered an unexpected effect. Men who took the medication experienced stronger erections. This discovery eventually led to the approval of Viagra as a treatment for erectile dysfunction. To understand why it works, we must first understand how erections happen in the body. An erection is mainly a process controlled by blood flow. When a man becomes sexually aroused, signals from the brain cause blood vessels in the penis to relax and widen. This allows blood to flow into specialized tissues, creating firmness. However, the body also produces an enzyme called PDE5. This enzyme can limit the chemical signals that keep those blood vessels relaxed. Viagra works by blocking the activity of this enzyme. When PDE5 is blocked, the blood vessels remain relaxed for longer periods, allowing more blood to enter the penis during sexual stimulation. As a result, erections become easier to achieve and maintain. One extremely important fact must be understood here. Viagra does not create sexual desire. It does not automatically cause an erection without stimulation. Instead, it simply supports the natural biological process that occurs when a man is already aroused. Because of this mechanism, Viagra has helped millions of men regain sexual confidence. Clinical studies have shown that men who take sildenafil experience significant improvement in erectile performance compared to those who take a placebo. But although the medication is effective, proper use is extremely important. Doctors typically recommend taking Viagra 30 to 60 minutes before sexual activity. The tablet is swallowed with water and begins working as it is absorbed into the bloodstream. The effects may last for several hours, although this varies from person to person. Most prescriptions range between 25 milligrams and 100 milligrams, depending on age, health conditions, and individual response. However, taking more than the recommended dose does not increase effectiveness. Instead, it increases the risk of side effects. Medical guidelines also recommend no more than one dose within a 24-hour period. For men with erectile dysfunction, this medication can improve both physical performance and psychological confidence. But like all medications, Viagra can also cause side effects. The most common side effects are relatively mild. Many users report headaches, facial flushing, nasal congestion, mild stomach discomfort, or temporary dizziness. These effects happen because sildenafil relaxes blood vessels throughout the body, not just in the penis. In most cases, these symptoms disappear naturally as the medication leaves the body. However, there are also rare but more serious complications. One of these is a condition known as priapism. This occurs when an erection lasts longer than 4 hours. Although rare, it requires immediate medical attention because prolonged blood trapping can damage tissue. Another important concern involves heart patients. Viagra can interact dangerously with certain heart medications, particularly those containing nitrates. When these drugs are combined, blood pressure can drop suddenly to dangerous levels. For this reason, men with cardiovascular disease should always consult a doctor before using sildenafil. Another rumor that many people have heard is that Viagra damages the kidneys. Current scientific evidence does not show that normal medical doses directly damage healthy kidneys. Most complications occur when the medication is misused, taken in excessive amounts, or purchased from illegal sources. Counterfeit versions of Viagra are unfortunately common in some markets. These fake pills may contain unknown substances that can be harmful to the body. This is why obtaining medication from legitimate medical sources is extremely important. Another important truth is that Viagra is not necessary for healthy young men who already have normal erectile function. The medication was designed specifically to treat erectile dysfunction. People who already have normal performance usually gain little benefit from taking it. Experts also emphasize that lifestyle plays a major role in sexual health. Regular exercise, maintaining a healthy weight, controlling blood pressure, reducing stress, and getting adequate sleep can all improve erectile function naturally. In many cases, erectile dysfunction is connected to underlying health conditions, such as diabetes, obesity, or cardiovascular disease. Addressing these conditions often improves sexual health without relying entirely on medication. So the scientific truth about Viagra is balanced. It is neither a miracle pill nor a dangerous poison. Instead, it is a powerful medical treatment that can significantly improve the lives of men who genuinely suffer from erectile dysfunction. When used correctly and responsibly under proper medical guidance, Sildenafil has helped millions of men regain confidence and improve their relationships. Understanding the facts, rather than believing rumors, is the best way to make informed decisions about health.